And with the COVID-19 pandemic battering many countries, the Ministry of Health foresaw that it would pose a significant risk to HIV service delivery for the people living with HIV. Likewise, the effects on both global and local supply chains for HIV health products cannot be ignored. Tonight, Dorcas Wangira explores the relentless effort and innovative practices to sustain services for people living with HIV and what people need to know about HIV and COVID-19.
In Kokwet village, Kapsabet, Nandi County, Anne Rono, a mother of 3, has mastered how to pace and prioritize her life in the time of a pandemic. She is one in 1.5 million people in the country living with HIV. She has lived with the virus for 18 years, but the new normal has significantly affected her social life. Most times she stays at home. There are 2 types of people living with HIV and AIDS who have high chances of immunosuppression. These are those who have HIV and don't know, and thus are not being treated, and those who are infected with the virus, initiated treatment, and either could not continue or do not adhere to their medication. These are the ones who become more vulnerable to being infected and severely affected with COVID-19. For the 1.2 million like Anne who are on antiretroviral therapy, continued therapy is crucial.
I'm a teacher, I'm now at home. The government has tried by taking drugs near to the people, but there are some people who are still having challenges in accessing the drugs.
The pandemic's net effect on people living with HIV is twofold. It poses a risk to HIV service delivery as a result of a disrupted global supply chain. In addition, older people living with HIV with heart or lung problems may be at risk of contracting the COVID-19 virus and suffering more severe symptoms. According to the Ministry of Health, by 25th July, HIV and AIDS accounted for 4% of the deaths, ranking 6th after hypertension, diabetes, and chronic lung diseases as well as cancers. On a given day, thousands of PL-HIVs seek services at clinics across the country. But with COVID-19, things changed.
To make sure that there is continuity of care, by giving people who are stable, people who are actually suppressed, medicines for relatively longer time, some for 3 months, some for 4 months. I'm also aware of people who got for 6 months.
We have one is fast track, whereby a client comes and directly go to the pharmacy and they're able to pick their drugs and go home. The second one is a community ART groups. There are, for example, a group of 12 who are HIV positive. Within that community, they will have a team leader then who will come to the facilities and pick the drugs on behalf of the other 12.
The multi-month dispensing has helped to reduce the physical need to access the healthcare system or the risk of running out of medicine. The intervention of the National AIDS and STIs Control Program, NASCOP, and the Network for the Empowerment of People Living with HIV and AIDS, NEFAC, and the Ministry of Health's COVID-19 response has seen an increased HIV prevention, care and treatment. However, there are still more challenges. For instance, the negative economic impact of COVID-19 has led to some people living with HIV and AIDS struggling, unable to meet their basic needs, particularly food, which is a crucial part of treatment.
Nawaendanga clinic na nikikutana nao wananiambia hawana transport, wamesema tukae nyumbani.
We are not accessing Septrin, and it is a very important drug to us people living with HIV.
For people living with HIV and AIDS, NASCOP advises that they should have ART medicine refills for not less than 3 months. They should stay at home and only go for scheduled clinic visits. If they have fever, cough and difficulty in breathing, they should seek medical attention. They should follow COVID-19 guidelines, including good respiratory hygiene and wear masks.
Because if you know your HIV status, you will be on treatment. The moment you are on treatment, your chances of complications with COVID will be reduced. For those who already know their status, this is the time to religiously adhere to your treatment.
Dorcas Wangira, Citizen TV, Nairobi.